Hello and welcome to Nursing Bites by Nadia. Today I'm going to continue the Fundamentals of Nursing series and I'm going to talk about Maslow's hierarchy of needs. Abraham Maslow developed a hierarchy of basic human needs that describes which needs of a person are the most important at any given time. Certain needs are more basic or essential than others and must be at least minimally met before other needs can be considered. Maslow's hierarchy is useful for understanding relationships among the basic human needs and for establishing priorities of care. This comes in handy specifically when you're answering NCLEX questions, the focus of which is prioritization. Nursing care is often directed toward meeting unmet or threatened needs. Maslow's hierarchy provides a framework for nursing assessment and for understanding the needs of most patients at all levels so that interventions to meet the priority needs become part of your care plan. Many nursing interventions are aimed at meeting patients' basic human needs. We will go through the hierarchy starting at the bottom with the most basic physiologic needs and progress up to the highest level of self-actualization. Physiologic needs are needs for oxygen, water, food, elimination, temperature, sexuality, physical activity, and rest. They must be met at least minimally to maintain life. Most healthy children and adults meet their physiologic needs through self-care, but meeting physiologic needs is often a major part of nursing care plan for young, old, disabled, and ill people who require assistance in meeting them. Physical safety and security means being protected from potential or actual harm. Nurses carry out a wide variety of activities to meet the patient's physical safety needs, such as the following: using proper hand hygiene and sterile techniques to prevent infection, using electrical equipment properly, administering medications knowledgeably, skillfully moving and ambulating patients, teaching patients about household chemicals that are dangerous to children. In addition to that, if you go back to the Florence Nightingale's theory about the environment that surrounds the patient, you obviously know that controlling patients, the temperature in a patient's room, aerating the area properly, all falls into the environmental dimension of the physical safety and security. The next level in the hierarchy has to do with social cultural dimension. All humans have a basic need for love and belonging. After physiologic and safety and security needs, this is the next priority. It's often called a higher level need. Love and belonging needs include the understanding and acceptance of others in both giving and receiving love, the feeling of belonging to groups such as families, peers, friends, a neighborhood, and a community. The highest priority on the hierarchy is self-esteem needs. It has to deal with intellectual and spiritual dimensions. These include the need for a person to feel good about himself or herself, to feel pride and a sense of accomplishment, and to believe that others also respect and appreciate those accomplishments. Positive self-esteem facilitates the patient's confidence and independence. Many factors affect self-esteem. When a person's role changes, for example, through an illness or death of a spouse, self-esteem can be seriously altered because the person's responsibilities and relationships also change. A change in body image, such as loss of a breast, or injury or growth spurt during puberty, may also affect the self-esteem. Nurses must remember that the person's perception of the change, rather than the actual change itself, is what affects the person's self-esteem. This concludes our brief overview of the Maslow's hierarchy of needs. If you have any questions or wish to see more topics covered, please leave a comment. Thank you. Bye.